Let's turn to health matters. Health experts say there is a need for an improvement in engagement with communities, HIV prevention and treatment services, as well as sustainable funding to improve health outcomes for key population. This formed discussions at a report dissemination meeting held in Abuja. TVC's Kemi Balogun reports.
Strengthening HIV and AIDS response strategies remains the goal to achieve epidemic control by 2030. Key population members and their sexual partners account for 54% of the new HIV infections globally. This dissemination meeting between experts in the HIV response is simply to discuss the challenges and successes faced in the implementation of HIV programs tailored specifically to vulnerable groups and key population.
And this gives us an opportunity to reflect on the experiences of those that are directly affected by the various programs that we've put in place. And this feedback is quite invaluable in gaining a comprehensive understanding of the HIV response.
Globally and in Nigeria, there's a lot of investment, especially now with the Global Fund. It started as a small pilot project with funding from UNAIDS, but now it's good to see it's gone national with a lot of funding, so it will be good to see what the results are.
Data collected across 18 states where programs are being implemented, representing nearly half of Nigeria's region, was used to evaluate the effectiveness of HIV prevention and care strategies for key populations in the country.
Even though there is small population, there is small percentage of the general population, but they are at the highest risk of contracting HIV and of the HIV epidemic. So we definitely need to, have programs and intervention in place.
Some of the key findings reveal that, one, the country has to do more in terms of training health personnel who provide services for key population. The country has to do more in terms of funding and financing key population programs, especially the component of domestic funding, the input from our own government into programs for the KPs.
HIV is a problem for everybody, and youths are risk perception among youths is quite low. So if we must win this war, everybody must play their part. That includes the youth. So adopting preventive methods, and then we also ensure that we're not stigmatizing or discriminating against people that are living with HIV/AIDS.
This initiative ultimately seeks to ensure that the insights and recommendations from the KPPR are utilized to strengthen HIV response strategies and achieve epidemic control by the year 2030. Kemi Balogun, TVC News, Abuja.
The federal government's decision to derecognize certificates awarded by some African universities is still generating